fourth Creating a Legacy Sustainability session. This is our fourth and final one in the series, so thanks for sticking it out with us. I'm joined by Julie Evan today, who will be helping to facilitate today's session, and we have some guest speakers as well. So really excited to have you all here today. To just do a brief recap of today's session, we'll just talk briefly if that you can share any reflections or thoughts about the homework for this session. So it was the Addressing High Priority Outcome Gaps worksheet, and also doing a draft action plan. The last time that we met, we talked a little bit about infrastructure and had some breakout groups. And then for today's session, our topic of the day is talking about sustaining training and strategies to help you think about how you can sustain trainings after your grants are over. And then we'll be talking a bit about action plans and walk through some examples together. And just a reminder, we've been using this sustainability planning model throughout the series. And so we've walked through some of these steps where we've talked about looking at the big picture and deciding what needs more work. And we're over here around step 6 to create sustainability steps. So really getting your action steps down into the action plan and thinking about how you can put it into action. And if you have the resources and partners, and if you've thought through the strategies and your assumptions about the strategies that you've been creating. So we're going to finish talking a bit about step 6 and step 7 today. And I'm actually going to hand it over to Julie at this point so that she can introduce our speakers.
Thanks, Sheila. So I'm really so appreciative of all of the speakers that we've had throughout the series. And today we're going to be talking about sustaining trainings, both through thinking about you have a gatekeeper training or a clinical provider training. Now, how do you keep it going? And also, how do you plan from earlier on in setting up your trainings to carry it forward after the life of the grant? So I'm going to introduce our two speakers, and as they're talking, pay attention to what kind of strategies they use in both of those veins to sustain their trainings and what made it effective. And then afterwards, we'll talk about some additional strategies as well. So first, I would like to introduce Dr. Karen Moses. Let me forward to her slide. There we go. Who's the director of Arizona State University Wellness. Welcome, Karen.
Thank you, Julie. Hello, everyone. And I'm just checking in to make sure that you can hear me.
So Karen, go ahead and take yourself off of speakerphone and onto your handset, if you don't mind.
Yes, that
Great.
I knew there was something
Perfect.
I was doing that wasn't quite right. So hello, everyone.
Perfect.
And I'm happy to have this opportunity to share with you today about the Campus Care Suicide Prevention Program that was established at ASU way back with the first round of the Garrett Lee Smith Campus Suicide Prevention Grants. And ASU was funded in Cohort 1 and Cohort 2, and I was privileged to be a part of the group that was coordinating the grant. So the framework of the program at ASU relied on partnerships across the university that transcended departments and disciplines, and we used a public health approach that incorporated primary prevention strategies as a core of our efforts. And I really attribute these two characteristics of our program as the key to continuing several of the components of the program, including the Campus Care Awareness and Skill Building Training programs. We did not use a quote-unquote canned gatekeeper training. We developed our own primarily because of the primary prevention component that we were emphasizing. ASU Counseling Services and ASU Wellness work together to co-coordinate the grant program. And during the 6 years that we were funded, we established a very strong working relationship that integrated both departments and gave us significant roles in developing the training program, working together as teams where staff would go out, one counseling center staff, one wellness staff would go out and provide the training, and then in analyzing the program evaluation and determining how we wanted across the departments to improve the training so that it could be as successful as possible. During the time that we were working on the grant, we discussed how we wanted to move forward, particularly at that time when we realized that the program coordinator that was being paid through the grant was not going to be paid through the grant. How are we really going to continue to stay the course in terms of the type of training program that we had put into place? And what we did was we assigned responsibilities within each of the departments to take on within ASU Wellness the coordination of the logistical part of the program, making sure that we together are on the schedule for the different trainings that come up every year annually, and making sure that we're promoting the Campus Care training program with the various groups of gatekeepers across ASU and student leaders that we want to make sure are getting the training. And then counseling services by providing trainers and additional staff who could work together during those peak training times. For example, during housing training, where we're training 500 students and paraprofessionals, and we have multiple training sessions, we need a team of trainers who can go out simultaneously and provide the training. So we would work together to make sure that the staff is trained and to ensure that we're continuing to fulfill our training commitment to the university. So one of the things that we learned along the way was really the benefits of incorporating primary prevention strategies into our gatekeeper training. So our role is in part during the training to help the group of trainees to understand, given their position within the university and their role, what they can do to help create a caring campus community. So for example, the role of resident assistants is in part to help students get connected, to provide opportunities for students to establish supportive friendship groups, to provide opportunities for students to learn to cope with stress, and to create a caring community, community of students who use and role model the use of feeling words, for example, and talk about feelings and ask, how are you, and really mean to get a true answer to that question and take the time to listen. So what we learned in the process was that students and student leaders and gatekeeper folks needed to learn not only, and at least from our philosophy, needed to learn not only how to identify signs of distress and help people to get to the services that could support them during difficult times, to ask the question, et cetera, but that we also really wanted to build, to move upstream in the public health model and to really charge our community with creating opportunities for students to cope with stress, to minimize stress, and to hopefully reduce their experiences of distress. And one of the reasons that we decided to continue using this model is because, frankly, this is our philosophy. We have a very, very large student body. We have more than 70,000 students at 4 campuses in the Phoenix area. And we need to really be able to trust and train individuals across the university to take on this role of helper, of people who can work with students who are heading towards emotional distress and helping them to get back on their feet and or to get into services if that's what is needed. We really believe that moving upstream to reduce distress will ultimately result in a smaller proportion of the student population requiring crisis intervention, which is more time intensive and requires a more highly trained staff and has more negative outcome possibilities. So we also believe that our resources are better utilized, again, when we call upon the entire community to reduce and respond to emotional distress. And then when everyone has a role and knows their role, we can be more effective and reducing and responding to emotional distress. So ultimately, we have continued to do a number of the programs that were started during the grant. And I attribute this to the same two key features of the partnership and the recognition of the value of primary prevention strategies in our suicide prevention efforts as being the foundation for our ability and intention to continue these programs. Thank you.
Thanks so much, Karen. I'm wondering if folks have any questions for Karen right now. And go ahead and unmute yourself and speak aloud if you do, or type it into the chat box. While people are thinking, I actually had a question for you, which is, I'm curious how you made the case for continuing the upstream training, because obviously it needed to be funded in some way, or made into part of people's jobs. And so how did you get folks to buy in to that concept? Was it difficult? Was it easy? What were some things that you did to really make sure that that kept going?
What we did was we recognized that irregardless of funding or not, that the strategy of getting a large cohort of individuals across the university to understand better their role in reducing emotional distress and identifying distress and getting people to services, the better off we will be as a university. So we basically know that we're going to be training various groups of students in their orientation process anyway. So applying this particular training model to those different training situations really made the most sense and makes the most sense. We do have times when we're juggling with people's schedules to try and put the training on the books. And yet, because we feel like this is important, and again, we're in the prevention business because we feel like prevention and helping to mitigate problems before they become too intense in every situation where that's possible, that actually helps to free up time of individuals who would otherwise be in those more intensive intervention situations. So I hope that sort of made sense. It's like we're utilizing our time differently, trusting that it will actually balance out.
That's great. Thank you. And as the director of ASU Wellness, were you kind of, okay, I can make that call, I can say this is our approach and this is our strategy, or did you have to make the case to somebody above you to convince them?
A little of both. So, being a director is a good role for being able to say, this is a commitment that we're going to make with our resources, that we're going to pay people to do these things, right? But in order for me to have the counseling staff participate in that, I need the counseling director to agree to that strategy. And certainly that is something that we talked about. We talked about in our team that was working on the grant. We talked about with our supervisors to, just verify that this was a strategy we wanted to continue with, and, got agreement with everyone and move forward. With no extra money, I should add, with no extra money just a commitment and acknowledgement that by doing what we can to reduce student distress and enhance their resilience, that ultimately that would create more change in the student community in regard to suicide prevention than we would be able to do by just managing crises from day to day.
Great. Thank you, Karen. That's really well put. So I'm not seeing any other questions right now. And if folks do have questions, please feel free to type those into the chat box as we go along, and we'll have a couple more minutes at the end. But I wanted to go to our next speaker. This is Melissa Sparks from the Tennessee Department of Mental Health and Substance Abuse Services. She's the Director of Crisis Services and Suicide Prevention. So welcome, Melissa.
Thank you so much. And of course, just as I'm beginning to start, there's huge sirens right outside the building, so please forgive me if you hear interference as we move forward. But I just want to take a few minutes to share some of the efforts Tennessee has made to try to sustain our efforts. Sustainability can be a real challenge, and we've had to be kind of creative and trying to think of ways that we can continue the efforts that we have been having going on in our Garrett Lee Smith grants. And we are very fortunate here in Tennessee to have the department fund the Tennessee Suicide Prevention Network. It is a statewide public-private organization that is responsible for implementing the Tennessee Strategy for Suicide Prevention as defined by the 2001 National Strategy for Suicide Prevention. Most states aren't fortunate enough to have a statewide network of this nature, but we are very, very pleased to have invested in this, and this is the primary way that we get all of our suicide prevention objectives met here in Tennessee. And you can always go to the tspn.org website if you have any if you want more information about the Tennessee Suicide Prevention Network, but that is one huge way that we've been able to sustain our training efforts. They are out there training a wide variety of professionals, including clergy, social workers, physicians, law enforcement, and even survivors of suicide and suicide attempts are involved in TSPN. So it is a wonderful initiative and helps us reach all the way across the state. One of the other things that we've attempted to do is to pass legislation that would require certain professionals to receive suicide prevention training as part of their continuing education hours in order to be licensed to practice here in Tennessee. We just made our first attempt this past year, and we ended up taken it out of the legislation just because we were meeting with some resistance from some of the professional boards that were going to be required to receive this education. We do believe that we'll be able to do some rewriting and re-present the legislation this next legislative session, so that there are a couple of other states who have successfully passed legislation like Washington and Kentucky, and that can be a real valuable means of being able to sustain that training and making sure that the professionals that are involved in this field receive the training that they need to do a great job. Some of the other things that we have done, Tennessee is also very fortunate to have a statewide crisis network. On the slide that you see now, there's actually a map of the state of Tennessee, and the different colors that you see there are actually different service areas. So we actually have 12 different contracted vendors out there that provide our crisis services, which include mobile crisis, walk-in triage, crisis stabilization units, and 800 statewide hotline number. So that gives you a kind of, we've got 95 counties here in Tennessee, and there's not one county that doesn't have coverage by our crisis system. So we've embedded trainers in each of those organizations to make sure that our crisis service providers are well prepared to address the suicide risk that they may encounter in their everyday activities. And the community often calls on those trainers to come out and train other organizations. So they are often involved in providing free training to their other local community organizations who might have an interest in getting that kind of training. And one of the most valuable things that I think we've done, because suicide prevention training can be costly and sometimes doesn't always meet the special needs of the particular population that is seeking the training, we have developed a couple of trainings that are specific to the specialized needs of the agency. One very well-known training that Tennessee has developed is the Shield of Care. The Shield of Care training was developed specifically for juvenile detention facilities, and that training was developed through task force kind of like work group activities, so that there were staff from those detention facilities involved in developing that curriculum. We're currently working on an emergency department online training curriculum that is geared towards the special needs of emergency department staff, and we have just found that it is very valuable as you're thinking about the training needs out there, that you try to develop your own training curriculums that are geared towards the special needs of that particular population. We have just finished developing a standardized law enforcement curriculum, which is going to be rolled out across all of our police academies here in Tennessee. That law enforcement curriculum has embedded in it some suicide prevention materials, but most importantly, it ensures that every officer, even if they're not CIT trained or crisis intervention team, if you don't know what CIT is, that they receive some kind of baseline information related to mental health, alcohol and drug, autism, and developmental disabilities, as well as what kind of behaviors they might expect to see in those different populations, and the best way that they can try to manage those behaviors in those special populations. So it's been very useful for us to try to develop these curriculums that kind of are specialized to the various needs. If you have any interest in seeing more information about the Shield of Care, it is on the SPRC evidence-based registry. It was developed really from the ground up, even though it did take into consideration a wide variety of existing curriculum such as ASSIST, QPR, In Harm's Way, the National Juvenile Detention Training Curriculum, and Response were all considered as informative approaches in the development process. But the majority of the curriculum content was built from the ground up, and that is available on the Department of Mental Health's website as well as the SPRC registry. So if I think that I'm about to run out of time, so I'll just open it up for questions at this time.
Thanks so much, Melissa. Does anybody have questions for Melissa? Feel free to unmute yourself if you're muted, say them aloud, or type them into the chat box. One thing, Melissa, I know that you had mentioned when we were chatting earlier was that you really worked with the juvenile justice folks to develop the Shields of Care training, so it was really based on what they were looking for. Is that correct?
That's absolutely correct. And the S plan, which is kind of what the Shield of Care is around, was all come up with based on the routine, normal activities that go on in the juvenile detention facilities. The S plan stands for Seeing, Protecting, Listening, Assessing, and Networking. And so that was absolutely derived, and it's called the Shield of Care because that is the way these juvenile justice professionals see themselves, as the shield of care in those juvenile detention facilities. And they were very, very involved in making sure that we understood, what the normal daily life looked like and what their needs were. And, it was completely tailored to what they told us.
Great, thanks. And I know that some other folks have done things where maybe they're not developing trainings from the ground up, but they are, they are adapting existing trainings, sometimes on their own or sometimes certain training developers kind of mandate that they work with them to adapt those trainings, but for specific settings, and I know that that's been very successful as well.
Yes.
So thank you very much, Melissa. I want to move into a couple more thoughts about trainings. Melissa and Karen, I hope you guys can stick around for a couple of minutes while we have a little bit of a group discussion about sustaining trainings.
Sure. Thank you so much.
Great. Thank you. So some additional strategies that I wanted to mention, and we'll open it up to the group in a moment to hear a little bit more about even more strategies, are one grantee that I work with. They have done an interesting approach. This is a campus grantee where they are doing QPR online on their campus, and they are subsidizing the cost of doing QPR online by working with their bookstore to sell promotional T-shirts and high-end, I believe it's coffee mugs, travel mugs, and they add a couple of dollars onto the cost of making those and selling them through the bookstore, and then they're able to use that money that comes back to subsidize the QPR online training. I heard about another example earlier today where folks are using their health services fee to help subsidize that. Again, that's a campus example. Some other things that I've heard people doing to help not only sustain the trainings but really get them up and running in the first place is to have new trainers co-train with experienced trainers so that they actually will train, because sometimes people have a little bit of cold feet once they've done their training of trainers, and they're a little hesitant to get started. Another grantee is saying, okay, as a condition of coming to the training of trainers, you agree to do X number of trainings per year, and we'll subsidize the cost of you attending this training, but if you don't do those trainings, we're actually going to ask you to pay back the cost of you attending the trainers. And the training, sorry. And then some other folks are getting somebody master trained or have some other recertification before the end of their grant for the existing trainers, if there is a certification process like that. So I just wanted to mention some of those strategies. And in addition, specific to strategies for continuing mental health provider training, I know that some folks who are doing specific mental health provider training, those may be expensive, and they're worried that folks won't pay the full price. But often after, particularly with state grantees, after their grant ends, they're just passing along the full cost of the training to the attendees, and they are finding that people still do sign up, so that's very encouraging. Other folks may be prioritizing high-risk settings like juvenile justice or foster care to train those mental health providers, and for after the grant is over, if there are any funds to primarily do those settings to be funded through the state, for example. Other folks have MOUs with agencies that they have some kind of influence over. So, for example, community mental health centers, and the MOUs include that everyone in the agency has to get trained. Other folks, as Melissa mentioned, maybe do some sort of legislation or a tribal mandate. And some folks have found that training their campuses, training their counseling center staff and community providers at the same time can help to sustain the trainings. So I wanted to open it up to hear from you all what kinds of sustainability strategies you are thinking about or you might want to use to sustain trainings. Dominique, can we switch to the notes layout? Thank you. So since it's a small group today, I was thinking maybe we would just go sort of quote unquote around the room and give everyone a chance to speak if they would like to, and do feel free to pass. So I hope that that's not putting folks on the spot, but I thought we'd just go down the attendee list on the right side of your screen. So if you can just unmute your phone when I call your name, and if you want to pass, that's fine. But I'm curious to hear, maybe starting with Barbara Moser, what strategies you could or will use to continue trainings after the grant ends. Barbara, do you have any thoughts you want to share? You sound like you might still be on mute.
Can you hear me?
Yes, now I can hear you.
Okay. um, so we have kind of two different main types of trainings that we're doing. One is suicide prevention Gatekeeper training through the Campus Connect program and some continuing education Campus Connect programs we call booster sessions. And we actually started those before our grant, and so we initiated that with a group of trainers who are largely based in our counseling service for students here on the campus, as well as our health promotion staff. We do also have some other trainers in the community, and so have looked for ways, because the program has expanded, to try and get departments to be a little more self-sustaining and apart from the counseling trainers. And so, for instance, our housing department, this summer we held a Train the Trainers for Campus Connect for some of the resident professional staff in the housing department, so that they now are able to train their RAs every year, since that's kind of a high turnover and we think a high yield area where there's lots of, direct student contact. So we're hoping that that will aid sustainability within housing. Likewise, our university police have several trainers now for Campus Connect within their department. And so it works to different extents in different areas. We're hopeful that the housing piece will really keep going. And at this point, we have plans that our counseling, health promotion staff will continue on as trainers as well. We have kind of a new, shorter training that we're doing for faculty and staff, which is encouraging them to reach out to students in distress. And so one way we're looking to increase longevity of that program, because that's a fairly new program, and we're in just starting our year 3, so we're just starting that, is to get that training process and the materials into our new faculty orientations, our new teaching assistant orientations, so and hopefully for all new staff orientations, so that if we can get into some of these routine functions, then those the folks running those orientations will just plan to call on the trainers to do these trainings on a routine basis. So those are kind of some of our current plans that we're up to.
Great. Thank you so much. Eddie, I'm wondering if you could say a little bit about what's going on at Saginaw Valley regarding your training sustainability.
We're in the early stages of conversing with some of the other colleges, the College of Nursing and Psychology. They've offered their assistance in our sustainability efforts, getting some faculty actually trained so that they can deliver here in the upcoming future. Um, but it's the nursing that's showing the most interest and providing the most resources to help us with this.
Great. Thank you. James, would you like to say a little bit about your thoughts on training sustainability? You may still be on mute. We're not hearing anything, so maybe we will come back to you, see if we can get you on the second go-round. Jennifer, do you want to say anything about training sustainability in Illinois?
Sure. One thing that what we had implemented through our grant was some online trainings, and the vendor actually, as part of our contract, had provided an additional year after the grant for us to have access to those. So that is part of our sustainability. Also, we plan to utilize that time to really work with our communities to identify how they can take that on within their schools. The online training is for school personnel, and so one thing we'd like to do is really, develop a plan of how we can help them identify ways where they can can support that after the funding. And so all of these ideas shared today are great ideas. Some of our schools is part of their task force strategic planning efforts to have that component. For others, it's for our for our high school, for our middle school and high school folks, it's there's a school code requirement, so they're able to utilize that as a way to continue to offer those and to seek support to help those meet those needs. And then also just knowing about how some of the other initiatives going on in the state. We do have another program within our State Board of Education who is promoting a different training. And so we're talking about how we can complement each other, and so how you can use both the trainings to meet different needs. And so being able to, I guess, piggyback on another initiative and just say how you're getting a much more comprehensive approach by addressing both. And so we're looking into those avenues of being able to plan for those trainings to be sustained afterwards.
Great, thank you. I'm going to do just a couple more folks so that we have time for the next sections as well. And then also maybe I'll ask Melissa and Karen to if they have anything to add. So Jonathan, I don't know if you could share anything about what you're thinking about for sustainability at this point for trainings.
Can you hear me?
Yes, thank you.
All right, yes, what we have planned for this year, as well as the years to come, is to continue to train the residential housing staff. Each year they have about 5 to 10, well, actually anywhere between 5 to 20 new staff coming in. So what we want to do is to train them in QPR, and then everyone else that has already been trained. We want to do booster trainings for them. And we are also, what I'm thinking that our director wants to do is look into working with the University Police and do booster trainings with them as well. As well as the nursing staff. I'm sorry, not the nursing staff, the School of Nursing. We've had a good success with them last year, and so with those new staff, the new students coming in from the School of Nursing, we want to try to work with them as well.
Great, thank you. I think one thing that's challenging is that in a lot of settings, people will sometimes do a training of trainers, but they don't have the infrastructure to have somebody who will help those new trainers to schedule the trainings. And so if folks are able to get even a tiny portion of somebody's some staff time to help those folks schedule the trainings, or some folks sound like they're embedding it within different departments that would have their own motivation to continue those trainings, like university police, that might be an effective strategy as well. But just thinking about, in addition to doing a training of trainer or booster session, how are those trainings going to keep going later on too? So that's definitely something to think about. And in terms of, who might be able to continue the trainings afterwards. I know that QPR, for example, and I didn't mean to focus this too much on you, Jonathan, but in general, QPR, they have a 3-year certification cycle, and so, is it possible for the campus to make a commitment to get those trainers, recertified after 3 years, for example? Starting to think about those pieces a little later down the road too, and how can you make sure that that part is also taken care of? Karen or Melissa, did anything you were hearing from folks spark anything for you to say, oh yeah, this is something you might want to also keep an eye on, or a lesson learned, or just anything real brief as we wrap up this section?
Well, I found all of the information beneficial, and am always very interested in hearing how other states or communities manage to sustain their efforts. But I didn't have any huge, epiphanies. The one thing that I would like to see happen as it relates to universities is trying to find a way to embed the curriculum into everybody's health-related field curriculum, so that they come out of school, whether they get licensed or not, they come out prepared to manage somebody who might be at risk of suicide. I'd love to hear it if anybody had thoughts about how to get that done.
Great. Thank you so much. So thanks very much again to Melissa and to Karen. And we're going to properly label these later. But I'm going to now turn it over to Sheila to talk a little bit about some strategies from the Sustainability Action Plans. And we'll just go to the other layout, please, Dominique. Great.
Great, sounds good. So one thing that we wanted to do was, we know that sometimes objectives, there's some common objectives across grantee groups, and we thought it might be helpful to walk through some of the questions related to some of these objectives, so that we can discuss as a group and kind of work through sometimes, figuring out the answers to all the questions that you might need to develop your action plan. So the first objective that we're going to discuss is increased knowledge about available mental health resources. So I realize that this might look different in different settings. I work primarily with campuses, and I know that sometimes there's efforts to create print materials, or either create a website or update information on a website. And then I know across grantee groups that there's often communications campaigns or different kinds of materials or messages that you're developing. So feel free to chat into the boxes, and I'll actually just include the first question that we're going to discuss for this one. Great, thanks, Julie.
Yeah.
And so in talking about increasing knowledge about available mental health resources, maybe we could just focus on, if you are working on a website or if you are creating print materials, to think about what resources, partners, or tools you would need to be able to sustain either updating that information or continuing to disseminate it. And I believe that you're all unmuted, so if you'd like to just chat, feel free to do that, but you can type in it as well. And I see that a handful of people are typing.
At risk, partners or tools. Anything else?
And if there is anyone that would just like to speak over or share over the phone, feel free to do that as well. So I see a couple people have typed in. So Jennifer says a template form to capture all the pertinent information and assign it to a work group to look at it on a regular basis to update and add information. And then Barbara mentioned that there's plans to sustain the website developed at University of Wisconsin through input from the Chancellor's Advisory Committee on Mental Health and Counseling. And then Rita mentioned they've been fortunate to work with the Switchboard of Miami and collaborate in training. So I'm assuming that's a partner in the community, Rita. And I think some people have kind of alluded to the importance. Yeah, a community partner, great. And some people were just alluding to the importance of updating information or adding new information. Because we know that sometimes you go to a website and the information is a bit outdated or phone numbers no longer work and things like that. So that is important to make sure that somebody has it as part of their responsibility to make sure that they're checking on that. And then incorporating the information into other university websites is important to continued support from the Dean of Students and outside support from community mental health and other outside referral resources. So I'm assuming a lot of people, part of the knowledge about mental health resources is letting people know about community resources. So perhaps there are communication materials or websites of other community agencies that you have to refer people to, and so making sure that those agencies' websites have the correct information sometime as well, or that the links to them, if you're putting them on your own websites, are working. Great, thanks for all those suggestions. So we talked a little bit about resources, partners, and tools. Let's move on to the second question. And who do you need to keep informed, and how will you do it? So I know a couple people mentioned having a work group or having other people, committees on campus, but I think sometimes we need to make sure how do you either make sure that people know that that's a task that we need to take care of, how do you kind of delegate that work so that people do take it on, or I think sometimes on campuses having either interns or students or graduate students, they can maybe take some of that work on as well. I think also sometimes having a plan for how often things might need to be updated, or how often somebody just might need to check links and numbers and things like that. So students will stay engaged with the process through the participation in their student advisory board. Great. So there's some sort of existing structure of students that you'd have to continue to stay in communication with and keep informed. Great. So I see community partners are having a listserv to share information between partners to stay informed. I know there's some listservs out there that are pretty helpful and active. The Health Center is building the suicide prevention position currently into their health center budget. That's great. And so this person will keep communication going. I know that when we talk about sustainability, that we know that funding isn't always out there, but that finding some amount of funding is usually important to keeping the activities going. And if you can have somebody who does still have it as part of their job responsibilities to schedule trainings or update information, that's always really helpful. That's a great point. So Jennifer says that the audience is the public, but also the stakeholders, which can be challenging when you try to determine who is your audience. I think that's a really great point. I know that the messaging. I think you all have probably heard about the framework for successful messaging that was recently released. But I think knowing your audience and what kinds of information you may share based upon whether it is the general public or whether it is key stakeholders or decision makers, they're all motivated by different kinds of information. So really tailoring your messages and thinking about what you're hoping people will do with the information you give them. There's some departments in the Dean of Students office. Great. So through their existing meeting and information sharing structures. So taking advantage of kind of bodies that already exist for communication purposes, and using business students to be a part of the meeting format to make sure you get the information out. That's great. I think campuses, many campuses often use different kinds of students and tap into the skills that they have available to them that way. So why don't we go on to the third question? See that a couple people are still typing for that one. So I think it's always important to have a discussion about what some of the potential barriers could be and how you might overcome them. It sounds like some people have some ideas for how increasing knowledge about mental health resources can be sustained, but what are some roadblocks that you might anticipate? And you might recognize these questions as being the questions that are on the action plan worksheet in the sustainability guide. So I know that some of you weren't able to necessarily draft an action plan before today, but that you might get to it later on. But having these kinds of conversations with your team or with your partners and just thinking through what you really need and who you need to make sure you're communicating with, and then thinking about what the roadblocks that you might run into might be. I see that a handful of people are typing. That's great. And feel free again to share over the phone if you'd prefer that. Great. So time and personnel, addressing them through leveraging support from various stakeholders on campus and in the community. Definitely. So having somebody who will continue to get the message out there about resources and have the time to do it. We have a crisis referral team who function as an advisory board and are developing a resource team to help with curriculum modules. Great. So I think sometimes for campuses, really infusing information into the curriculum has been a successful strategy on some campuses. And then Barbara's mentioning about having evaluation tools, continue to assess progress regarding suicide prevention knowledge or any evidence of backsliding. So concerned about the time any discipline to keep up a rigorous evaluation process. Absolutely, I think often decision makers on campus want to know that what you're doing is working, and the best way to do that is getting some of that rigorous evaluation data, which is challenging to do, especially after maybe the grant is over and there's not somebody who really has that as part of their job description. Lack of personnel, dedicated volunteers are often great to have, and I think we all know that volunteers often pick up a good brunt of the work in different settings, but there's always a challenge sometimes. Great. These are all really great ideas.
I'm wondering, Sheila, this is Julie, as folks are typing in some of the challenges, and certainly folks are also talking a little bit about how to overcome those. I'm wondering if people have any ideas for each other about how to overcome some of these challenges. So for example, on the evaluation question that Barbara mentioned, will we have the time, money, discipline to keep up a rigorous evaluation process? Wondering if anyone has any thoughts around that. I know that that's a challenge for a lot of folks.
So Barbara, I wonder if there are other people either in health promotion who are evaluating other prevention programs. I know there's often kind of a sexual health or alcohol prevention program. Would that, I don't know if that's a possibility.
Hi, this is Barbara. Can you hear me?
Yep.
Okay. Yeah, I mean, I think it's really got to be built into someone's actual duties and position description, or it's not going to happen. And I think health promotion is the right place to think about putting that responsibility. I think the other thing is if we can, really use our data well this year before the grant ends to really demonstrate what we're doing or where the gaps still lie and get some higher level buy-in already, then hopefully those same people who are looking at the data will want to see ongoing data to see, continued improvement. And so I think maybe, trying to really engage people with our evaluation data this year before the grant ends so that they're just coming to expect it. That may help too.
Yeah, that sounds like a great way. So putting something in front of them that they'll miss when it's no longer there.
Right.
I think a lot of people have mentioned personnel. So this is great. Thanks to all of you for sharing all of this. I hope it's sort of been helpful to think about. I'm going to pass it over to Julie now to walk through another example.
Thanks, Sheila. And I'll just say that regarding Jonathan's comment at the end there, presenting this to decision makers to have new staff in place to meet the goal, just referring back to some of what we talked about during the first session around communications and, thinking about communicating to dean of students or communicating to, provost's office, et cetera, or, to your state legislators, if your state or tribal council, community members to get the buy-in and create a groundswell, just remembering some of those prior strategies that we talked about to accomplish some of these, to overcome some of these roadblocks and accomplish some of the goals. So we're going to go on to our next objective, which is increasing school adoption of suicide prevention activities. So I realize that a lot of folks were actually kind of putting in more general comments for some of the questions in the previous one, which is totally fine. But when when you all are filling out the action plans, if you haven't already done so, you are going to be, as Sheila mentioned, sort of thinking through all of these different questions and then coming up with the plan itself in terms of what the action steps are that you'll need to take in order to accomplish these different strategies, and who's going to take them, what's the time frame, et cetera, and thinking through some of the barriers so that you don't kind of go down a road and then just get stuck. But so in terms of school adoption of suicide prevention activities, this might be a little bit more community focused, maybe a little bit more relevant for those of you who are state and tribal grantees, but certainly other folks may have some thoughts as well that may relate to a college or university setting. So what resources, partners, and or tools would you need for sustainability of school suicide prevention activities?
And then the last, increased school adoption.
And maybe we'll do another little bit of around the room, so feel free to keep chatting in, but maybe I'll go to Kip Alashio and see if you have any thoughts on how could you overall increase, and I guess in your case it would be campus adoption of suicide prevention activities. We were just talking about some of that a little bit, but I don't know if you have any further thoughts. So feel free to unmute yourself. Go ahead. I think you are on mute now.
Can you hear me
All right,
now?
Oh, yes, great.
Okay. We have a variety of different gatekeeper training programs, sort of a menu, if you will, that various iterations of them meet the needs of different groups on campus, from students all the way through staff and faculty, et cetera. And the gap that we identified was something that would be really available to students in particular, who would not come to a type of training, and faculty who didn't want to take the time to come to something 8 hours long, like the mental health first aid training, which we do. And so at risk, the Cognito program sort of filled that for us. And so our sustainability efforts really focus on communicating the availability of the variety of gatekeeper training programs that we have, and encouraging people to receive training in any of them. And one of the ways that we're doing that is by coordinating them through what we're calling a Mental Health Allies program. And this is going to be a campus-wide program, if you will, that will encourage people to become a mental health ally by completing an appropriate level of gatekeeper training program for themselves, and then getting this designation and getting a button or a plaque for their door or something like that, and keeping this up kind of across campus so that the whole concept of there being people on campus that care enough and feel confident and competent enough to talk to somebody a student who may be struggling with some emotional distress, and determine whether a referral is appropriate and how to make that referral, so that the whole area of this early intervention is sort of taken up within the university community. So in order for us, for sustainability purposes, the thing that we need most is access to the at-risk program, which supplements what we already do in person. So that's one of our main foci. And it's so important to us that we're pretty sure that the powers that be are going to be able to increase our funding to continue to purchase access to that as we need it in future years. The other thing that we're doing is of course, involves how to get people to, especially students, to complete that training. And so along those lines, we're really happy that the university has finally agreed to a first-year experience course that all incoming students would take over the course of their first semester. And as part of that, one of the sessions of that course is going to involve completing the at-risk program and having people from our staff come in and debrief them, so that at some point or another, the ideal would be that all first-year students would end up getting that experience. And then if they wanted to become a mental health ally as a result of that, they could do that, and we would coordinate that program.
Great. So it sounds like you are going to be getting the funding that you would need to continue those online trainings, as well as you have the structure in place to continue the in-person trainings as well. And now you'll have the forum to do that through the freshman experience classes. And it sounds like with the mental health allies, I don't know if you already have this, but if not, you may want to have a way to communicate across campus about their presence, to create that culture that you were talking about of, not only that there are people there who care and people can talk to them, but that other people know that. So,
right. And that's where we have buttons and signs that we hope to sort of be very present on campus. Yeah.
Right. Great. Liz, I'm wondering if you want to say anything about your efforts around, I don't know if you're doing school-based programming, if you have any thoughts around that, sustaining, what would you need, resources, partners, and/or tools?
For me, I work with the Native American community in an urban setting, and we don't work off of a reservation or anything like that, so it's a little bit more complicated for us. But one thing that we are doing, or we're working on right now in the Omaha area, we have 3 service areas. One's in Scottsbluff, one is in Lincoln, and one is in Omaha. So I can speak for Omaha. In Omaha, we have a coalition that's being developed right now, and one of our things is to have a partnership with the public schools and have them be trained for the QPR, and hopefully that would help maintain sustainability, because if we have the staff trained, then hopefully we can have the families trained too. So that's one thing that we're doing right now. But yeah, we're not working on campuses, but yeah, that's
right. No, I translated that to a campus example so that Kip would be able to, and others will be able to answer that too, who are working in a campus setting. But really, the original objective was around more like high school or middle school.
Yeah.
So that's great to hear your example. And with the QPR trainers, are there any barriers that you anticipate? Sort of skipping it over to question 3.
Well, as of right now, the person that we're partnering with, we're kind of doing the I guess the planning process for the coalition, and the person that or the program that I'm partnering with is a trainer for QPR. So I think that would work well, because then she would be able to provide the QPR training to whomever within that. So that wouldn't be a barrier, but we did have that as a barrier in the past, because it was kind of hard for us to find a trainer to do that for us.
Mm-hmm.
So,
Great.
but that's what we're doing right now. So hopefully it'll work and continue.
Mm-hmm. Great. Thank you. Michelle, do you want to say anything about how you're thinking about sustaining your school-based prevention work? Michelle, I don't know if you're on mute.
Yes, I was on mute, sorry.
Ah,
I
okay,
am
no
in my
problem.
office and it's moving, so I put it on mute. Well,
Okay.
one thing that I want to share with you is this year through the GLS, what we're going to do is we're going to continue our trainings statewide. We're going to offer the lifeline trainings, the post-pension intervention, also the QPR, working with those beverages by suicide, and several other trainings that we are implementing, as I said before, statewide. Uh, at the same time, we have 22 schools, middle and high schools, that are going to continue the implementation of sources of strength. Uh, we're going to continue to work with them. We have a local evaluation for Rochester University. The way that we this year, what we are trying to do in order to think about sustainability and what is going to happen next year is to link our um, sources of strength programs at the school with the suicide prevention coalitions we have around the state. Um, Practically, the local program coordinator has been attending to the Suicide Prevention Coalition and keep them updated about the activities and the impact of the program at each school and each community. And the coalitions around the state have some fundings, and they are supporting sources of strength in many, many ways. And so that's one of the plans that we have for next year, to continue our work with middle and high schools and colleges at the same time. It's linking them with the suicide prevention coalitions that we have around the state.
That's great. So that sounds like it really speaks to the question, too, that the action plan preparation goes through, which who should you keep informed and how will you do it? So keeping those coalitions informed about the suicide prevention trainings and how they're going to
Yes.
really keep them bought in and financially supporting those trainings, it sounds
Yes,
like.
because as the kids and the students develop activities that impact the school, some of the activities impact the entire community, but sometimes people doesn't know what's going on. But by have this liaison between the schools and the coalitions, we have been able to keep them informed, and we have key people sitting around the table that pass the voice to others, and that's what is the plan, to keep going and moving with maybe not sources of strength itself, but at least the outcomes of the program at each school and college.
Great. I know also, thank you, Michelle. I know also one strategy that people do use to continue school-based prevention activities is to make sure that the schools, and this really applies to any level of school, have protocols in place, so both crisis protocols and postvention protocols if possible, and that the school community is educated about those protocols. So that's kind of one backbone, if you will, of school-based prevention work. Jennifer also chatted in school administrators may also be really important to keep informed, so possibly community service members, perhaps parents and families, great. And Jennifer had also mentioned before, which I didn't get a chance to read aloud, was finding a champion in the school, that would be a really useful resource or partner to keep sustainability, to keep the programming going in that school. Some folks also will embed trainers, and I don't know if someone mentioned that already. I'm trying to frantically read the different comments that, these are all great comments that people are putting in. But for example, training the school counselor as a trainer in your gatekeeper or student training, or else possibly having somebody in the school district who can do trainings at various different school and community locations. But sometimes schools may be more likely to buy in if they see it as somebody internal rather than somebody external. And then also they don't have to pay for the trainings if that's the case. So any thoughts on other potential barriers and how we might overcome them? We just have a couple more minutes for this section, but I'm curious if folks have any additional barriers that they want to mention. Right, I'm not hearing any right now. That's totally fine. I'm wondering if we want to just also throw out some general ideas, or I see some people are typing in about barriers, just generally on how do you keep suicide prevention on the radar of some of the important decision makers, stakeholders in the community. I know that for tribal folks, and this is for reservation-based folks, but I don't know if it's true for urban Indian centers as well, to really keep it on the radar of, say, the tribal council or the elders. But I think this really applies to other settings too, is how can you make sure that this stays on the radar screen of people who have some big say in the matter. So Barbara Moser mentioned look for alternative funding sources, possibly community partners to fund printed resources. So this also relates back to the previous objective about keeping folks aware of different mental health resources that are available. Fund printed resources developed during the grant period, so you can print those ahead of time, which, you know, there's a balance there. If stuff is sort of timeless, that's really great to be able to print stuff ahead of time. If stuff maybe it is more related to something timely, or if it's about, you know, the current roadblocks or attitudes of folks around, that may be more time sensitive, where their attitudes may change over time, so that needs to change. Rachel also mentioned embedding a barrier is embedding suicide prevention into the fabric of college life. Well said. So that's great. They have some funding and they already are doing some event arranging. Great. And Liz is typing in one more comment here. So while Liz is typing that in, I'll just say, you know, these are really good thoughts that folks are having, and I hope you're finding it useful to hear thoughts from other folks too. So keep these in mind as you're going forward and developing your action plans. And we didn't flash up a visual of the action plan because we thought it might be more valuable to just sort of talk strategy. But you do have those in your guides as well, your workbooks. So Liz mentioned the coalition that they're developing in Omaha focused toward Native Americans, right? And you mentioned that in a previous meeting. That's great. Focusing on involving the elders and the go-getters in the community to be part of the coalition. That's really great. I think that'll be really helpful. Wonderful. So we're going to transition now to wrap things up. And does anybody have any additional questions at this point? Comments? All right. Hearing none, I'm going to keep going. So thank you so much. This has been really great and really enjoyed working with you all over these 4 series. And so thank you so much for coming and sharing your thoughts with everyone. Please continue to work on your worksheets. Bring your partners together if you haven't already done so. We realize that this summer was a great time for some, not as good a time for others, but this is, you can keep going with this process. And do share whatever worksheets that you've done, and especially your action plan when it's done with your prevention specialist and with your GPO and your TAL. I'm sure that they will want to see those as well, especially the action plans. And if you do want more feedback, please talk to your prevention specialist, and they will be happy to help you with, either thinking through the strategies themselves, or if you're confused about how to fill out any of the worksheets or you want to bounce ideas off, they are happy to do that. And last, please do fill out one more evaluation, which will help us to get feedback about the overall sustainability workshop series to better plan, if we do it in the future, how we might want to tweak things and make it better for the next cohort. So I just wanted to say thank you very much to Dominique Liu, who's been our stellar tech person, really wonderful. And thank you to Sheila for your fabulous co-facilitation. And also a shout out to Roz Lozier, one of the campus GPOs, who was able to join us today to just gain a little bit more insight into what everybody is planning on doing. Thanks so much, and take care, everybody. Have a great rest of your